I supposed to go for the checkup in SGH, and I missed for a few months. So I said, it's okay, never mind. I'm doing perfect and perfectly fine. I don't feel any problems with me.
So I see a lot of patients who are still quite well and they can still come to clinic visit. And I think that's a good time to start the conversation. Hi, Ma'am Teo. Hi, Mr. Sim. So glad you could come. Please come in. Compared to Advanced Medical Directive, Advanced Care Planning is a lot more helpful and useful because AMDs actually might be very hard to assess, and patients may not have told their family members about their AMD, so it might come to a shock to the family members as well. But in Advanced Care Planning, if the conversation has been started early, the family would know and they were able to accept the decision when the time comes as well.
So I never want to explore this topic because to me it's a sad topic. The questions came, both of us sat down together and we answered the questions. If there's any doubt, I'll ask her and she'll tell me that this is what she wants. And this gives me a very great assurance, and I suddenly feel that my burden is much lesser.
The doctor would ask him, would you want her to continue to keep her alive? It's very tough for him to say yes or no. So I decide for myself. So I would say this is the kind of protections that I want to give to my family.
I'm very touched by certain things that she says, something about not burdening us and become a slightly better husband that day by understanding what she wants.
We have been training doctors and nurses to be advanced care planning advocates, to have them have that initial conversation with the patient. Since they have been caring for the patient and have the existing relationship, they're the best people to know whether the patient is ready to have that conversation. It's important for them to know not only what decision the patient made, but also to understand how this patient arrived at those decisions. This will then help them with the medical intervention. So if they feel that the patient is ready and receptive, we will then proceed to have the advanced care planning discussion.
First thing in my mind is I want to go back and tell my parents about this ACP, and I make the decision instead of them have to make a decision for me, and then there will be no finger pointing. This is something that I can foresee that this kind of conflict sure will come. So if I can do this to minimize the burden, why not?